Welcome back if you're just tuning in. This is Dreamcity on Unilag 103.1 FM. And of course, we're moving straight to the second segment of the show. And today we have a special guest in the studio, and we're going to be discussing a very, very special topic. It's pharmacy and its role in the society. And it's important for our audience to know because most of the time, when a lot of people are not feeling fine, the first place they go to before they head over to the hospital is the pharmacy. They need to get drugs or get prescription before heading down to the hospital, and it's very important to know how important pharmacists are in the society. And we have a very qualified clinical pharmacist in the building today. She's right here in the studio. Her name is Ose Oyakilome. She's a dedicated clinical pharmacist with a passion for public health and community well-being, with a strong work ethic and a people-oriented approach. Ose has been making a positive impact in the healthcare industry for several years. Currently employed at OneHealth in Lagos, Nigeria, Ose plays a crucial role in ensuring optimal patient care and customer satisfaction. Her expertise in clinical pharmacy allows her to provide valuable insights and guidance to both patients and healthcare professionals. She actively promotes public health education and health promotion initiatives, contributing to the overall well-being of the community. And of course, we'll be having this conversation from right now to 11:58 a.m. And we have tons and tons of questions lined up for her today. How are you doing this morning, Ose? Good to have you on the show.
Thank you very much for having me on this show. I'm glad to be here.
You're welcome.
Thank you very much.
It's a pleasure to have you on Dreamcity. The thing is, a lot of people in Nigeria, they're used to self-medication. We most times, often than not, we just assume that we have headache, so the next thing to do is take paracetamol, or we are feeling some symptoms of weakness and we conclude it's malaria. What are your thoughts on self-medication?
Okay, so first and foremost, self-medication is not the best way to go about treating an ailment or illness that a person thinks that they have. And another thing is, self-medication opens the room for drug misuse and abuse. Do you understand? For example, somebody is having headache, and then because the person thinks, 2 paracetamol is not enough for me for my headache, and then the person takes 4 tablets of paracetamol and takes it consecutively over a course of 2 weeks, which is very bad for you. So that's drug abuse. Also, maybe somebody just has maybe a slight throat itch. Maybe the person is allergic to something, but the person concludes, I need antibiotics, and then goes to buy antibiotics and just takes 2 at once, and then it's done for the day.
Often, very, very often times, you see people, just going to the pharmacy and requesting for Ampiclox or some drugs that they might not even know the side effects of what they're doing. They just end up getting drugs. So what does being a clinical pharmacist entail? Is there any difference between a clinical pharmacist and an everyday pharmacist?
Okay, so now the only difference between a clinical pharmacist and a community pharmacist or industrial pharmacist now is the experience in pharmaceutical care, especially in a clinical setting. And when I say clinical settings, like hospital, that is the clinical setting, right? A clinical pharmacist has more experience in that area because most times it's either you've gotten 1 extra year of study, or you expanded after, because we do 1 year internship after our induction or graduation. So, and then you did it in a hospital, and from there you just decided to grow your career through that experience in a hospital. So that person is a clinical pharmacist. And basically any pharmacist that indulges in patient care is a clinical pharmacist. So a community pharmacist can also be a clinical pharmacist.
Okay.
So patient care and pharmaceutical care is different. And it will be statistics. Let me put it like that. There's a lot of research involved. So you go online and you see 80% of people in Nigeria are suffering from communicable diseases or non-communicable diseases. About 75% of people are having your graduation dates, right? And that helps us to be well equipped with new techniques, new medications that are in the market for optimum treatment and getting the most effective treatment for people. Also, personally, there are some apps, I don't know if I'll do free marketing, but there are some apps I personally use. You can go on the Google Play Store or the Apple iStore and just get medicine apps. There are a lot of them. I can't even start mentioning. And they send you emails, they send you newsletters. Oh, this is the latest research. This is the new drug. Even if most of these things are not available, especially in the society we are, but keeping up to date can also improve your knowledge and help you to see, okay, where is this gap in knowledge that we have in our society, and then you can make an improvement or in that space.
Okay, and of course, staying abreast, up to date is a requirement in that field. Basically, in every sphere of life, you have to stay up to date. How has the battle against substandard drugs been in recent times? This has, I know it's partly NAFDAC question, it's partly a pharmaceutical question. Yeah. So, how's the battle against substandard drugs been?
The battle, should I say, it's better. I don't know if that is what I should say, because of the development of technology. That is why I would say it has improved a bit. Back in the days when our Mrs. Dr. Dora Akunyili of blessed memory was battling this, it was more of like a physical, method or a physical approach, yes, to it. But now you have authentication apps. You have the Check It app. You have what the Ministry of Health is using, authentication numbers and all that you are able to scratch and then text them to know if it's an original medication. So I would say technology has played a part in making sure substandard medications are reduced, or the selling of substandard medications are reduced. But now the issue now is in like rural communities where the public doesn't even know these things are available. So when they don't even see it on the medication, they don't mind. It's not an issue for them. So I would say that's where the focus is right now.
Okay. And I am asking what the easiest solution to medication abuse is. So some people have gone through some sort of illness or pains, and they tend to resort to pain-killing drugs, which can be addictive. Even some people, once they go out and they come back and they have headache, the next thing is to take paracetamol and other kind of drugs that would make them feel better. And constantly doing this over a period of time, they do not know or they do not realize that they are abusing such drugs. How can there be a solution to let them know that they are abusing this drug and try to make them stay off it?
Okay, there's something I always say. Health education can never be too much. Health education can never be too much. They may not know. Paracetamol is not even a drug that people will consider abused, right? Because it doesn't contain any addictive substances or active ingredients, right? But I think what you abuse means they're not taking the correct way it's supposed to be taken. Yes. So health education is very important, even right from the pharmacists, the community pharmacists, because like you said at the beginning of the show, we are like the first point of call for illnesses. So there is a duty or an assignment for the pharmacists now to always tell their patients, educate their patients, whether it is online, offline. I'm happy that we have budding health influencers that are doing this now. So health education cannot be overemphasized. They need to know the consequences of everything, whether it's drug abuse, drug misuse, or just drug abuse generally, whatever it is called, any other name that it is called. There are consequences for this. There are consequences to the body organs. There are consequences to your to the mind. You understand? Psychologically, physically, to the organs, even to your environment at large. If you're not talking of more addictive substances. So health education, I think, is very, very important.
Okay. All right. If you're just tuning in, this is Dream City on Unilag 103.1 FM. And of course, if you do want to watch us live, head over to Instagram at Dreamcity Lagos. At Dreamcity Lagos all together. And that's where we have now a discussion. You can watch us live there. If you do want to send WhatsApp messages, the number to send your WhatsApp messages to is 0802 093 3638. So WhatsApp messages if you have questions for our guests, 0802 093 3638. And of course, if you do want to call to participate, if you have questions for our guests, the number's called is 0708 117 0185. And there's a question that I've always been meaning to ask. It's I have the opportunity to ask a question today, so I'm going to ask it. How do pharmacists read doctor's handwriting?
Okay. Wow, that one. I don't know now if to reply that is intuition or experience, or because we already know these drugs, right? So we just see, some letters that look like the name of the drug, and then we just put two and two together, and then just magically gets it.
Okay. So because I've been meaning to ask that question, it's always like they're not writing anything on a piece of paper. But thank you for clarifying that now. So tell us about OneHealth, NG.
So OneHealth is a tech health platform which ensures that the customer get their medication needs, and also that patients take charge of their health end to end. And end to end meaning they know where to source their drugs from, and then they can also get their drugs. That's from beginning to end. They are taking charge of their health. They know they can consult the doctors, they can do their lab tests, they can get their medications end to end. So that's what we mean by that. And so far, we've been able to reach people from all over the nation. We have partners all over Nigeria. So somebody from Abuja can be calling us that they need social medication, and they get it delivered in less than 2 hours.
Oh, wow.
Yes. So that is the benefit of OneHealth. And it's thanks to our founder, Mrs. Adela Ali. She came up with this idea in 2019, and so far so good. It has been wonderful.
It's interesting. So you're having a platform where it's like a walk-in consultation area where you can get drugs, you can get advice and everything online.
Yes.
That's interesting.
Exactly.
So what role do you play in OneHealth, NG?
Okay, I'm one of the team in charge of One Wellness. One Wellness is a chronic health platform. Now, we offer care. We call ourselves care partners to people with chronic illnesses, such as hypertension, diabetes, asthma, psoriasis, and different illnesses. Although not only chronic medications though, we attend to people that also may have doubts about their health advice and everything. And then we also have HMO partners that we do business with also. So if you want to register your HMO, or if you want to have HMO for you and your family, you can also come over.
Well, that's interesting.
Yes.
How best can you advise patients on side effects of certain drugs?
Okay.
That's one question that it bothers a lot of people out there. There are drugs that have side effects, and how best can you advise patients on the side effects of certain drugs?
Okay, as a pharmacist, now there's something we call drug therapy problems, right? And side effects is one of them. It's even one of the major things, because it can lead somebody into it can inhibit somebody. Yes. So first of all, something that is very important as a pharmacist, patient history. You need to know your patient. You need to know the person that you're attending to. You need to know their allergies. You need to know what they eat. You need to know the drugs they've been taking before. Because side effects also can occur as a result of, should I say, interaction with those things. Although side effects are a characteristic of the drug itself. It's something that can occur because of the drug. not because of any other thing. So, and it can increase with interaction with those things. So that's what I said, the health condition, the things the person is taking, and the other drugs that the person has taken. So the best way to advise the patient is to actually tell them as it is. This drug can cause so. When you see it, don't be afraid, because some people will take a drug and say, oh, I was urinating for so long a time, I could not sleep, and you just said, okay, it's part of it. Do you know what? Let's change when you are taking it. You understand? It's just to make sure that the person does not panic. So I would say, tell it to the person how it is. These are what can happen. Then also always have a contact. The person should have a contact to their pharmacist.
Okay.
Yes. That's
Okay. And sometimes patients come to the pharmacy directly. How do you assess their condition and prescribe a drug?
Okay, so if they come, patient history, because, and also physical appearance for some conditions. Patient history, because you are not there with the patient. The patient can just tell you, oh, I have malaria, give me malaria tablets. It's your duty to now say, okay, so how have you been feeling? When did it start? What have you noticed? And you ask open-ended questions. You don't just ask a question like, have you been having fever? And then the person is like, yes. What about headache? Yes. Because you will not be able to get information that way. You have to ask open-ended questions. It's like you are telling the person, you are giving the chance to the patient, or you are giving a chance to the patient to actually express themselves. Close-ended questions, just yes and no. So you open-ended questions first for patient history and assessment. And also, it helps to have a keen eye as a pharmacist, because sometimes the physical appearance tells a lot. For example, if somebody's eyes are yellow, if somebody's skin has maybe dry, patched, breaking skin, if the person has rashes, if the person has a blister on the mouth, even though it's not so big, there are some people that just have, yes, or just different colors. Some people may look white, they are dark in complexion, but they look pale, things like that. So it helps to have a keen eye, and I think that's true experience also, for you to note all these things, and also knowledge of the medication you have. Yes, so you have to know the kind of drugs that you have in stock.
So this also includes people who are referred to. So a lot of times people are just they are referred to a certain drug. So there might be a woman in the society or in the neighborhood who said a child had similar experience, and she took this drug. But because body differs, as you said, medical history, that person is already playing the role of a pharmacist. Most times the other lady might just go into the pharmacy and say, give me this drug.
Yes.
So in such a case, how can you still educate that person apart from the medical history? How can you ask the person how the person got to know about this drug, or if the person has had an encounter with such a drug before?
Okay, for that, I would say practically, especially if you are using mothers as an example.
It's not a true job at Nigerian mothers.
No, it's not. They actually, there are some disadvantages, but there are also some advantages. They educate themselves a lot, like especially when they have new children, first-time mothers and experienced mothers. They educate themselves a lot. Now, if a mother should come in and say, okay, give me this brand of paracetamol, that one is not an issue.
Okay.
What I'm saying is there are specific medications that you would question.
Okay.
No doubt. Antibiotics are part of it, especially for a child. If a mother should walk in, oh, give me this antibiotic. Ma, please, what do you want to use it for? She would explain. She's a mother. She will always, I'm just using mothers now an example. Then if you have a young person, oh, I want this brand of drugs, or I want this drug, do you have it? Yes, we do, but please, can I know what you want to use it for? And then the person might explain in bits, but I think the intuition or experience, most especially, can also help you put two and two together. And then there's some kind of advice you will give concerning the drug that will make the person even talk. Like if you say, oh, if you take this thing, and especially when you are telling them the side effects.
Yes.
Oh, if you take this thing, your hands may look yellow for some time, but it's like, well, what if I'm taking it for this? You've already gotten an answer. So that's
okay.
it.
So what are your thoughts on drugs that people want to buy without prescription, without doctor's prescription? A lot of time people go to the pharmacy and say, I want a drug, and you ask them for the prescription and they run away. What are your thoughts on that?
It's procedure. We are following procedure. You cannot sell some particular medications without prescription. So if a person should come to the pharmacy and say, okay, give me so medication, and I ask, sorry, please, where's your prescription? And then you run away. There's nothing I can do. I can't help you. You have to provide a prescription. It's for your safety and my safety, and for the safety of the society.
Sure.
Yeah.
Sure. Well, good one. And can you tell us about some strategies in improving medication adherence?
Yes. So that's a very good question, because that's one of the things we do at One Wellness, medication adherence. So some strategies include provision of other options. For example, somebody might have been prescribed a very expensive drug in the past, and due to financial, difficulties, person cannot afford that brand of medication. There are other brands that are affordable and do the same work. Like, you have verified their quality.
Okay.
You know that, okay, this brand produces good medications. You can also prescribe it for them.
Okay, so I was even going to get to that part. So, as a lot of times, some particular brands are very scarce on the market. So, as long as it's the same compounds and chemicals that are used to make a different, the same drug but a different brand, it's still acceptable, right?
It's dicey. There are some companies you cannot tell their quality.
Okay.
And you want to provide your patients with quality medication.
Okay, but as long as the pharmacy advises you that it's a good substitute,
yes,
you can go ahead.
You can go
ahead. Because I usually run into that kind of.
You can go ahead.
Okay.
You can go ahead.
All right. Thank you for that. And what are some of the common challenges that you've experienced in your line of work?
Okay, I'm going because I worked in a hospital. I worked in community. So from the two and here at OneHealth.
Give us the 2 years.
Okay, so from hospital pharmacy, I can say definitely funding. Funding generally, because the funding is a big issue, and also with the patients and with the hospital itself, there are some drugs that we cannot get because of funding, and then for the patients too, drugs are expensive. And somebody just coming into the emergency ward and just staying for one night, and the person is paying a huge amount of money, it gets kind of difficult. And also communication with the patients and patient relatives, sometimes it's very hard to get through to them. And then in community too, communication, especially when you do not speak their language. I think that's one thing that is taught to us in school also, that if you cannot if you're working in an environment that they have a particular language you speak, I think you should be intentional about knowing it. At least if you cannot speak it, you should be able to understand a little bit. I think it helps. I don't know, it's just you're just caring.
So some of us are bad with languages, but we'll try.
Yeah, you're just being caring. Do you understand? It's not a must, but it's just caring. It's a hindrance too. And also prices of medications too. The way things are set up these days, medication is expensive. So you see somebody coming in, oh, I want to buy this for 1,000 naira, and you can't even help the person, because if the one of it is 1,000 naira, and then you have to find a way to just get the person to be well, or the person doesn't have the ability to afford it. Then working in OneHealth, communication is a major thing. Because we do a lot of virtual work. So communication and response, trying to make the person understand what the services that you are offering in virtual communication is kind of harder than physical communication. So that's another thing. Then also getting patients to take care of themselves. through medication adherence, through following the regimen, exercises, eating well. Because you are not physical, how would I put it? Because you are not somebody that they will go and see. They just do anything, and then when stuff happens, they come say, "Oh, pharmacist, this is I checked my blood sugar yesterday and it was 300 and something. Ma, I sent you a regimen. What is happening?" Oh, it has been kind of hard for me to so that kind of thing. So health education constantly. If you don't do this is what will happen.
Okay.
Yes. So those are the challenges.
And of course, we're talking pharmacy and its role in the society. And if you do want to watch us live, just head over to Instagram at Dreamcity Lagos. At Dreamcity Lagos. And of course, if you do have questions for our guest, Ose Oyakilome, number's called is 0708 117 0185. I'll take number again, 0708 117 0185. And of course, if you do want to send WhatsApp messages in case you're shy, number to send your WhatsApp messages to 0802 093 3638. I'll take number again, 0802 093 3638. And of course, Ose Oyakilome is a dedicated clinical pharmacist with a passion for public health and community well-being, with a strong work ethic and people-oriented approach. Ose has been making a positive impact in the healthcare industry for several years. Currently employed at OneHealth NG in Lagos, Nigeria, Ose plays a crucial role in ensuring optimal patient care and customer satisfaction. Her expertise in clinical pharmacy allows her to provide valuable insights and guidance to both patients and healthcare professionals. She actively promotes public health education and health promotion initiatives, contributing to the overall well-being of the community. And of course, we've been having so much fun. We're asking questions. At least I've learned a couple of things from my guests today. I always learn every Thursday, but these are real life situations that we have to adhere to. And also, how do you approach medication therapy for patients with multiple chronic conditions?
Okay, so first and foremost, you want to know the chronic conditions that the person has. There might be a major one. Like some people are major, like the first thing that happened to them was that they had diabetes, and then other things came after. So now you call them comorbidities. They are co-diseases. You understand? So after, you want to know the conditions, and then next you want to be able to see what step they have taken in the past. You understand? What are the drugs they are taking? What exercises are they doing? Because most chronic illnesses are due to maybe lack of exercise, and then food and their diets most of the time. Also, is it a genetic illness? That's patient history now. Is it genetic? Did somebody in their family have it? Diabetes and hypertension, they come in the genes, So what is their family history? What is their social history? Do they drink? Do they smoke? Do they
do all of the above?
Yeah, they do all of the above. Yes. So those are things that we take. What are they allergic to? You need this because, first of all, for people with chronic illnesses, their diet is managed. So you need to know the foods that they will avoid, and also the drugs that they will avoid. Then next, after getting this history, you now want to know the drug interaction. Because these people take a lot of medications. Some people take up to 12. 12 medications. So you want to know, will this drug interact with this drug? Will this drug cause toxicity of this medication? Because there are some drugs you take that will not allow the other drugs you are taking to be metabolized or to be processed by the body.
Okay.
And they just store up in the body and become poisonous. You don't want that. So you want to know. And it also gives you a good basis for how to dose the medications, right? If somebody is taking this drug in the morning that will affect this drug that they're also supposed to take, you can space it, okay, you take this one in the morning, take this one in the afternoon, so they don't clash. That's basically it. Medication management is very important, and also non-medical supports like I said, exercises, food and diet management, and also seeing specialists. Make sure they are seeing specialists. Most of them, once they see the pharmacist, That's all. They don't go and see maybe endocrinologist or.
Well, because we're in a country that a lot of people do not have the means to see specialists.
True. That's very true.
They just end up, managing resources and just seeing pharmacists. And I was even going to ask, maybe at some point, do you think pharmacists are going to evolve into specialists?
No, that's not. That's not.
I mean, the way the country is going right now,
I know.
because we do know that in Nigeria right now, we're playing more than one role in the country.
Sure,
so the thing is that if you're doing just one thing, it looks like you're not doing enough. So a lot of people are getting more exposed to more certifications, more learning methods. So maybe the state of the country might allow people to, like pharmacists, become specialists.
The specialization we do is like, okay, you're a dedicated maybe cancer pharmacist. That's you deal with cancer drugs, anti-cancer medications. Okay, you're a dedicated maybe pharmacist that deals with kidney medications and all that. That's the specialization we do. You cannot become how would I put it now? We cannot become
a specialist.
Yeah, specialist like MD. You cannot be that except you go to school again.
Okay.
And graduate.
All right, that's good. So much insight, so much learning points, and of course, mistakes are present in every profession. But what are the common mistakes made in the pharmaceutical practice?
Okay, so one major mistake which I have fallen, a prey to is assuming, assumption. That is a very terrible thing to do, especially when you are in charge of the life of people. You asked a question before on doctor's handwriting. Yes. So as a pharmacist, yes, you're expected to know the doctor's handwriting, but there are some particular cases where you cannot read it.
Okay.
I'm thankful for groups like on Telegram and WhatsApp that you're able to even ask somebody like, what did this person write? If you don't have access to the doctor that prescribed it, or you cannot get somebody, I think it's better you just ask instead of assuming, because the person's condition, especially in community pharmacy, you are not privy to what took the person to the hospital. Let's say the person is coming with a prescription from a hospital. You are not privy to the information. You don't know why the person went there, so you cannot just start assuming, okay, this is the drug because they look alike. You need to ask somebody or ask anybody, or you can even ask the patient to get the number of the doctor that prescribed it so you can ask and not assume. Or even assuming people's symptoms. I'm grateful that so far the people that I've worked under are willing to teach me. Somebody comes in and then you see somebody that is having maybe issues and you feel like it looks like the one that you have handled before. Meanwhile, it can be a completely different thing. My senior colleagues of pharmacy will be like, do not be afraid to refer the person to a hospital. If you know you cannot handle it, don't make mistakes. Don't be afraid to refer the person to a hospital, to tell the person to go see a doctor. So, yes.
Okay, because we're almost out of time, I'm going to ask one last question. In a minute or two, okay, so I don't even know the question I want to ask again because I'm trying to make it short. So, are we going to see an increase in pharmaceutical companies in Nigeria in the nearest future?
That's a difficult question.
I had to ask it.
Hopefully. Majorly production, I hope. Because it reduces costs of medication for us.
Okay.
Yeah, so hopefully.
Alright. And of course, thank you Ose Oyakilome and thank you Adalbi for being right here in the studio today. It's been an amazing show. We're already used up our time. It's been a lovely discussion, and of course it's been pharmacy and its role in the society. I've learned quite a lot. I'm sure my listeners out there have also learned a lot. So we come your way next week. This is Dreamcity on Unilag 103.1. Dreamcity will be back next week Thursday. Do have a lovely productive day.
Thank you for having me.
All right. Thank you.
Instagram live.
Okay. Yeah, don't worry.
Thank you.
Ah!